we are here with Dr. L and Brody. Hello, Dr. L.
Hello.
So, do your spiel with the mast cells.
Okay. So mast cell tumor is probably the most common, at least potentially malignant skin cancer in dogs. And we say potentially malignant because there's always that possibility, but the majority of cases we see are like this. They're short-haired breeds in California. We think there may be an association with allergies and maybe sun exposure, something like that. And these guys get multifocal primary tumors. So each one of these is an independent tumor. They don't, it's not spreading from one place to another in the skin. So each one can be dealt with as they grow locally, and they can get swollen, like you've seen. Part of that is tumor growth, but mostly it's this inflammatory reaction, because these are cells that are part of the allergic part of the immune system. So any dog that gets an insect bite could have the same kind of reaction. In fact, if a dog that has mast cell tumor gets an insect bite and has an allergic reaction to it, all the mast cell tumors will actually get enlarged, because it's that systemic reaction to an allergic response. So most dogs like this, these short-haired breeds, boxers, ridgebacks, bull mastiffs, bull terriers, can actually live their normal lifespan with this disease. And I know that because of cases I've seen, but also because of my own dog. I had a ridgeback that had this. And he lived for 6 years after his first tumor was diagnosed. And I took the first 2 off. One I used radiation therapy to control. It was something like this one on the side of his leg. I mean, they wanted to take it off. They were going to cause too much damage to the muscle. And so I didn't want them to do that, so we did radiation. None of the ones we removed or radiated ever came back. 2 years later, he got 2 more. So they don't necessarily increase in frequency either. Each one is coming up whenever it does. But once they've had more than one, they could have 2, 3, 4, any number of different tumors. So after the first year and a half with my dog, I decided to not do surgery anymore, and I just left him. And he died of old age, 6 years.
Oh, of course it is. Okay, we're continuing the mast cell.
So, in cases like this, there's a range of possibilities of treatment. No matter what treatment it is, our aim is good quality of life for as long as possible. It's not to cure at all cost. We never want the treatment to be worse than the disease. So when we treat cancer, we're very conservative compared to humans. This is Dr. Ohashi, by the way, my intern.
Hi.
This is one of the friendly boxers.
Boxers are mostly friendly. Stop giving Sachi a bad name.
So the choices in these patients are, of course, to leave them and let them be, and you deal with what you can deal with. He's having problems because he's getting sort of degranulation that can have a release of the histamines and cause a swelling. So you put them on Benadryl, antihistamine. If they're on Benadryl, they should be on Pepsid, which is also an antihistamine but protects the stomach. And then prednisone is an anti-inflammatory, but it's also anti-cancer for this. The problem is long-term prednisone. It has side effects for the liver, and it's not an optimal thing to use. So usually in cases like this, for long-term control, if we feel like we have to, because the tumors tend to swell, we use a drug called chlorambucil or Leukeran. It's a chemo agent. Do you have a question?
It's like, keep talking, Dr. L. Keep talking. I like it. Everybody loves your voice. Remember, Sachi fellows asked me, do you think, knowing his temperament, he's going to be able to handle the radiation for his brain tumor? And I looked at Sachi, and he's laying on his feet snoring, and I'm like, he's ready for you.
Okay, she had to recover him, though.
I did, but anyway.
Yeah. We put her in a room with him, all on her own.
Yeah. Took the tube out and everything, my Sachi. Yeah.
So this drug is very well handled. It's given every other day, and it will control the tumors. It's not going to cure it, but it will control it. And then we use, I think if they have mast cell disease, they should be on the antihistamines, because that can sort of protect them to some extent from excessive reaction. And you keep the prednisone at home, so that if and when they do get an acute swelling because they got into something or whatever, you will control it. And then we use, I think if they have mast cell disease, they should be on the antihistamines, because that can sort of protect them to some extent from excessive reaction. And you keep the prednisone at home, so that if and when they do get an acute swelling because they got into something or whatever, you put them on pred for a short period of time, get back under control. Pred always needs to be tapered down, reduced slowly, and then you know, you're back on the course again. And they may have episodes that go up and down. They may have new tumors that come up. If there are tumors in any particular areas that are problematic and keep on swelling or rupture and bleed, those could be taken off, or they could be radiated to keep them under control. There you go. Where these guys really get sick is because of actually those chemicals, not so much the tumors. High histamine levels increase acid, they can develop ulcers, they can have throwing up, vomiting, those kinds of things. But up until the time they have anything as severe as that, they usually completely normal, have a normal life. So do your little, my favorite saying of yours, if a dog has to have cancer. So, if a dog is going to have cancer, especially a boxer, this is a good one to have. Yeah, so you got it, a free lecture from the eminence here, Mr. Dr. L, about mast cell tumors. So in the case of Brody, you basically Pepsid and Benadryl, we're going to keep that on a daily basis. Going to put him on Leukeran? Yes. Okay. Now, Leukeran now has gone from, what did you used to pay for? Oh, it was so cheap when I had my... it was like $30 a month or something. No. Now it's like over $170, $180. Is there another medication? You can get it compounded. So the compounded generic is called chlorambucil. And we order it from a compounding pharmacy. We use Pet Health Pharmacy. Is it cheaper? It's $15. Okay, that's what I want. Yeah. Is it going to be the same thing? Same thing. Then hello. Yeah. Okay. Dr. L, thank you so much for all this. It's my pleasure, as always. And I have your authorization to post your big speech on mast cells as long as I get the check in the mail, no problem. Oh, it's always in the mail with me. Trust me. Thank you so much.